Today's episode is going to be a little heavy on the procedural, which is, I have to say, Lana's forte. So I'll be asking questions and hearing her take on ins and outs of a hospital visit.
I got some troubles and I don't know what to do. I got some worries and I'll share them all with you. Sometimes we'll talk it out, or maybe scream and shout. It's always easy when I see you through with you, 'cause we are two old friends talking to old friends. Not too old, two old friends.
This is Lisa.
And this is Lana.
And we are taking care of our parents. This is a podcast about what to expect when you're not expecting it.
Two old friends talking to old friends.
There's two different types of hospital visits. One is the one you expect, like they're getting a knee replacement or eye surgery or heart surgery, and you can plan for it. And the other one is one that you do not expect. Something acute happens and they are rushed to the hospital. We're going to start with when it's planned. Now, there's also two different types of things here, too. Are you already caregiving for your parents?
That's true, Lisa. Yeah.
Are you already taking care of them and doing that thing? And you're like, wow, they get to go into the hospital and I get a little bit of a break. Or is this a moment where you're like, oh my gosh, mom's not going to be able to walk for the next 2 months and I've got to step in and begin the journey of caregiving, the first step toward it. So, Lana, what are the steps that we have to do to prepare before our parent goes into the hospital?
I would say most of the admissions to the hospitals that are planned, like you said, are surgeries.
Okay.
So usually that's not, sometimes it is, but usually it's not urgent. You have time to make a plan, but what you have to really think about is really trying to be proactive and anticipate the needs.
Okay.
When you talk to the surgeon, I would say, hey, what are some of the things that we need to do? Do most patients have a shower chair? Yeah. Okay, well, go get that right now. You don't have to wait until they're hospitalized.
Okay.
Or do most patients have a walker? Yeah, well, get that right now. And
Okay.
if they can start practicing using that equipment
That's
when
brilliant.
they're feeling good, or you can even get authorization for home care to come into your home and say, hey, I've got a planned surgery coming up. Will the physical therapist help me get ready? So I'm used to using a walker.
And make sure the house is set up. I didn't even think about that.
Absolutely.
Because you might have tables or things in the way, and so you want to make sure that your house is set up for it.
And they will have an eye for that. So that is time well invested, well spent. When you don't feel good and you're in pain, that is the last thing you want to do is learn how to use a walker.
Okay. And also, I think getting your parent ready for expectations.
Right.
Because a lot of times, especially if it's something that's been bothering them, they're like, and then I'm going to go in and I'm going to feel so much better when I come out. But we have to have realistic expectations, finding out what will they be feeling like when they come out? How long is the recovery? So they're not, are they going to be at home for this recovery? Are they going to be someplace else? You can start those conversations early before to say these are the various things that might happen and get them acclimated so that it's not a surprise. The least amount of surprises you can have, even if your mom or dad has not had you as their caregiver, quote unquote, it doesn't matter. There is a vulnerability.
Yep.
Vulnerability.
And you have to think about all the things. So my recommendation is just really walk through, okay, these are the routines. How are they brushing their teeth? Where are they going to take a shower? How are they going to get dressed? Can they get their socks on? I mean, not to be too graphic, but like if they're having arm surgery and it's their dominant hand, how are they going to wipe themselves?
Yeah.
How are they going to get on the toilet? How are they going to get off the toilet? All those things you have to just like dissect. Okay, so where are they going to watch TV? You have to go through all the things and what their day looks like. Okay, how are they going to get ready for bed?
And what you're saying basically is it's better to try to start. You're not going to have all the answers.
Nope.
But it's better to at least have some of them addressed because you might find out from the surgeon that they are going to need a ton of assistance and maybe you're not capable of doing all of that.
Right.
You got to set up caregivers. You got to set up family members, neighbors who might be able to come over and give food or whatever. So there's a lot to think about and to talk to with the surgeon and with people who are in the know about what's to be expected.
Surgeons are busy, so they're not going to talk about those types of things. So they usually have a nurse in the office that you can talk to and just say, we really just need to walk through some of this. We don't know. Never had surgery before. Can we just talk through?
Got it.
Like, what have you helped other patients with?
Okay.
So, meal prep, all those things that you can think about. One thing that we didn't think about is the pets. So, my parents have to let the dog out, and where they live, they have to pick the poop up. Well, they couldn't do that. So then we had to get a poop picker upper that they didn't have to bend over with, and we had to do a whole new routine for the pet, letting the pet out.
Love it. So good.
And the other thing is, how are they going to get to the hospital? How are they going to get home in their new condition? So if you've got this Ford pickup truck that your mom is 5'2", and she can't climb into that. So you may have to borrow a van or something to get them home. It's going to look different.
And they might be in a wheelchair, for all you know.
They might be in a wheelchair.
Or even for my dad's sake, they might even be on a gurney or on a bed, not capable of actually sitting up. So that is definitely something to be aware of. How are you going to get them to and from? And, I think we talked about this before. Some plans, Medicaid, some people's insurance will cover the cost of that transportation and some won't. So that's another thing. You got to be looking at, are you going to have to invest in this? Is there anyone you know who has a van that can accommodate a wheelchair? We have a friend who we utilize that a ton. So finding out if it's covered and if it's not, what are your options and who can you ask for help? That's awesome.
And think about how far away your hospital is. If you're going for the ride home, if it's a 2-hour drive, you're going to have to think about well, what do we need in the car for the 2 hours on the way home? They might throw up. So what are you going to do about that? So just think about how far do you have
you're
to...
just scaring everybody.
I know,
right now,
I know, but you're going to be prepared. You're going to do awesome.
No, this is really good information. I think we all wish we had it.
And the other thing that people don't realize that they can do is they can negotiate the time and the date. A lot of times they'll say, okay, well, your surgery is on the 12th, but we don't know what time it's going to be. So then you get a call the night before. And when you are in the surgeon's office, just say, we want an afternoon slot. It depends on the surgeon and the hospital and things like that. But we
at least try to make a request.
At least try your very best and say, is there any way that we don't have to get up at 3:30 in the morning to get our mom and dad or, there at 5:30 in the morning? And that's tough to do. That is really tough to do.
Do they ever bring them in the night before to get them ready for that? Or is that no?
No, that's not covered.
All right.
So negotiating the date and the time, make sure that you make your needs known and think about that. Because a lot of times it's super early in the morning and elderly people, that just does not work very well.
You said, if you're 2 hours away,
right,
then that's not 3:30.
It's 1:30 in the morning. So a lot of times what my husband and I have done, because he's had a lot of surgeries, is we will spend the night in a hotel room so we can just get that little bit of extra sleep. But again, that's more with parents and pets, and that might not be worth it.
Right.
And the other thing you need to be proactive about is, okay, so who is going to the hospital? Is the primary caregiver? Usually you have a stronger of the two. So if your mom is a primary caregiver.
So basically what you're saying is that the mom is taking care of the dad.
Right.
Okay.
At any level. So my dad is fairly independent, but I think he would struggle if my mom was in the I know he would struggle if my mom was in the hospital.
So
for
you're not
5
only
days.
having to worry about the person who's in the hospital, you're actually having to worry about the person who's left home.
Right. So you have to start thinking about that too. It's oh crap, my mom.
Yeah.
I mean, my dad is not bedridden like yours, but he does need some assistance.
Yep,
a little,
Well, we'd had that when my mom went in when we thought she was having that heart attack, and I took her into the hospital. My sister had to Zoom from over an hour and a half away to be with my dad there. I can't just leave him. I can't take her to the hospital and then just leave him home.
Right.
So there are things to consider if you have time to prepare. If you don't have time to prepare, I would say perhaps, if you like the word proactive, be proactive and know in the future who possibly can you call for an acute situation.
Right.
A neighbor, somebody that you can say, can I reach out to you if anything happens?
Yeah. And we actually, with that pet situation, we have a gal that we can call loves the dog. We knew that was going to be a lot, so she took the dog for a week.
Perfect.
That's
lovely.
If you do, that's a great advice.
So is there anything else for when it's planned?
I can't think of anything really else for planned. Well, I'm sure there is. I'm missing it, but But anytime you do go into the hospital, you have to bring your driver's license and your insurance card. And that was one thing where it's almost like you get on an airplane. It's like, I need to see your driver's license. I was like, oh, God, yeah.
You and I talked
You have
about
to prove your identity.
and prove that you're covered. Okay, that's really good to remember because I can envision that being. And also, there's other things. I'm just thinking about them now. When I thought about bringing my dad in, is the hospital has stuff. I'm not saying they don't, but my dad with his colostomy bag, you have to pack up and get stuff ready for that because even though they might have certain things, it might not be the kind that you use. So you're going to want to bring in anything that they require for their health that they use in a consistent way, not only just for comfort, but sometimes out of necessity. So you want to have that prepared. We live a mile away from the hospital, so anytime we forgot something, we could just zoom back. But if you do not live a mile away from the hospital, then you got to prepare.
The other thing I would say is if you have planned, like, don't have your mom wear her 1-carat diamond ring to the hospital.
Good point.
Okay, because that can get lost. It gets lost in linens. I mean, so nothing valuable. So it just really think about, like, what are you bringing in the hospital? Because it could get stolen, and most of the time it just gets lost. So we have lost 2 cell phones and 3 pairs of glasses in the hospital.
Oh, good Lord.
It gets caught, they're changing sheets.
Yeah,
they
of
put their
course.
glasses in and off. No one is intently trying to lose glasses, but it just happens. So nothing, with an exclamation point, nothing valuable because it does get lost.
If your parent is in a situation where they are on a lot of different medications, don't expect that the hospital has, what did you say? They don't necessarily have records. Some of them do have records of their history, but you're going to have to know, or your parent's going to have to know that history. And you know better if your mom or dad is capable of relaying that information. But if not, you want to make sure that you...
And the doctors, they love it when you bring the pill bottles in.
Yeah.
Because the list, there still could be errors. And that's a big responsibility for them. They really want to keep your parents healthy too. So if they can actually look at the source of truth, which is the pill bottles. But here is the trick. You have to take them home because you cannot,
use the medicine at the hospital.
Right.
Yeah.
And your parents may say, they're used to that routine. They don't understand that. And they may dip back into those pills. And again, those could get lost. And then you go home and you have no pills. So fine to bring them in, but you have to bring them home. So your parents don't. And I had to take away like Tylenol, ibuprofen in my mom's purse because or aspirin. Those are very strong. You think, well, those are over the counter, so who cares? Well, they all have bleeding properties and
if they're already giving them Tylenol intravenously and suddenly they pop a Tylenol.
Yeah, that's not good. So really no meds from home, except it is very helpful for the physician to make a really good decision about what they need to be on, and then they've got the accurate dose. So.
Absolutely, because I know that my dad is taking one of those. What's the milligrams? I don't know. He just takes one of those. You know what I mean? Like so you want to have the bottle because you don't necessarily know the dosage. You just know maybe the quantity, but that's not going to tell anybody unless you know what the dosage is. So yeah, having the bottle, highly recommend. Then we have the acute situation, right? Where your dad's got a UTI, or somebody's not breathing right, or somebody is, like my mom had symptoms from the night before that really did reflect a woman having a heart attack. She wasn't at that moment, but I needed to get her in. My dad has definitely had a blocked stoma. He's had high fever, and he's had a lot of UTIs. Those are your 911 calls after you first freak out and circle the house, as I usually do, trying to figure out what I'm supposed to do. After I've circled the house and then finally called 911, then I'm going to use your word proactive again. It's kind of like the fire drills, when you're a kid, is if you are prepared for the unexpected, then when it happens, you know that you reach into this drawer for the list of this, and you get their wallet, and you know where everything is and what you're going to need. So even if you have a checklist, maybe, I've never thought about this before,
That's
but if
a really good idea.
Right? Have a checklist of the things that you are going to need, because I got to tell you, your heart is racing.
Yes, and it's very scary.
It's very scary, and you cannot think. And so all of a sudden you're like, oh, what do we have? And again, we live a mile away. yeah, we would often have to zoom back to the house to get stuff. But if you don't, you want to have everything with you. So I really would advise a checklist of all the things that you're going to need.
And where are
right.
I mean, I know where my parents' meds are.
Yep.
You may be new to caregiving, so you need to understand, like, well, where do they keep their meds? I mean, you might have to go home, get them, come back, whatever.
I have actually taken pictures of medicine bottles
that's
too.
a
I just wanted
really
to say
good
that with your cell
idea.
phone, take your pictures. Yeah, I did that one time when I didn't want to bring in something. I just took a picture of it.
I love that idea. So then it's there.
Yeah.
Yeah. That's a really good idea.
Yeah. So then, like you said, their wallet, and then what was the document?
It's an advance directive.
Yeah. So
an advance directive is a legal document saying what their wishes are. And so hopefully you've had this conversation beforehand. Every time you go into the hospital, they legally have to ask you about that. And then they give you this paperwork, and then nobody does it. So I am just stressing, and this is not the conversation, but if you do have that completed, make sure you have a copy of that. They recommend just putting like a copy on your fridge with a magnet. So again, I think my mom and dad's are in a 5-inch binder somewhere. I don't know where it is.
Me too.
I'm just thinking this through. Jeff's parents do have a copy of it on their fridge because that was really encouraged by home care. So it's nice, just you need to know where that is so you can grab it. I have no idea where my mom and dad's are right now.
Right.
I know what they say, and we've had the conversation, but I don't know where they are. So that's something I need to work on.
Yeah. We'll see. Now we're learning for ourselves.
Yeah.
I know that when my mom was in the hospital and my dad was the next day was not able to communicate with us at all, and we called 911 with my sister and I, and as they're taking him out, they said, do you have a DNR? Is this do not resuscitate? Yeah. And I got to tell you, we both just sat there with our mouths hanging open because, yes, I know my dad has said he does not want, any big, huge things done to keep him alive. But it is a different thing when you, getting a document, because they really weren't walking away until I was able to answer that. And we both, to say, yes, it's a DNR. So if he, his heart stops on the, minute drive to the don't do anything, that is a really weird thing to say to somebody. Yep, just let him go. See ya. We'll meet you at the hospital. I really, it's so uncomfortable that I'm not joking. We both had our mouths hanging open and looked at each other like, yeah, but yes, if we had the paperwork, then I could just be like, here it is. I didn't have to say it out loud. It's right here. So I highly advise that because it is a very awkward moment.
Well, and sometimes they won't honor that. Because let's just set this up. So you two sisters agree with that, and I'm making this up. This isn't true, but let's just pretend your brother doesn't.
Right.
So that's a whole thing.
Yep.
So a lot of times they will not honor that until they see the document.
Yep. And if your parents are in an acute situation, they're not necessarily able to answer that question. No. I know when my dad went into the hospital, it was a very weird moment, but they were like screaming in his ear because he's like deaf. He's like, I can't really hear you. So she is screaming, if you stop breathing or your heart stops, would you like us to let you pass? And it was just like.
And your dad would probably be like, well, is there a double line? Am I in the car? What is happening here?
Yeah.
Yeah.
That's another episode about the tough conversations.
Yes.
But it is important for your family to know because our hospital, I was really surprised at how I thought it was like, yeah, you can do, if he's choking, do the Heimlich. But if he's not, you know what I mean? Like, I felt like there should be like some level of that, but it was all or nothing. And I thought, okay, that was very startling to me. So don't be surprised. Best not to be surprised.
There
are levels. Yeah. That hospital, no level.
Okay.
All or nothing. So yeah, once they've been brought in, either way. So we're talking about admittance, and we've kind of gone over the pills and stuff like that. But what other things can we expect?
Well, I think your parents really need an advocate. So we talked about being an advocate for their medications and making sure that but also you need to communicate that this is where their baseline was or is. So they need to understand, like, before they had this done, we want them to return to this baseline. So a lot of times when people have anesthesia and when they're elderly, they get very confused. So you can articulate that and say, well, this isn't their baseline.
Right.
They weren't confused before. Or
Gotcha.
They were confused before. This is normal.
This is normal. It is sometimes hard to tell if it's dementia, Alzheimer's, confusion, or cognitive issues, hearing issues, or it's just the anesthesia. You're right.
And you also have to advocate for safety. So if they now say, okay, you have to use a walker or you have to call the nurse before you get up, and you know as an advocate, they're not going to do that. So you need to very clearly say, that's a great plan, but that's not going to happen. So you better put an alarm on their bed. So if they get out of bed.
Oh, they have that?
Yeah.
Okay.
Then that will. And
trigger
I
and let
want
everybody know.
the bed close to the nurse's station. So if you have your parents with an alarm on the bed, advocate for that to get as close to the nurse's station as possible, because seconds matter. Okay, they hear the alarm, and the hospitals are really good about, like, just they drop everything and everybody trucks down. But if it's a quarter mile, I mean, sometimes these hospitals are really long.
Our little hospital is fine, but yes, I could imagine.
I mean, so advocate for that. If your parents have a history of confusion, say, we want a bed by the nurse's station.
I think what I'm learning from you and a lot of this is what I didn't fully understand is how much we can actually ask for. And not that you're going to be the complete squeaky wheel. But
yeah, and if you explain the rationale and just say, I'm really concerned, the nurse is going to be absolutely, they want to take care of them. And that's why they're nursing.
Right.
So if they can, no, there may not be a bed, but you can
It just
ask.
never occurred to me to actually that I could ask. I think that's my thing is I'm like, you just do what they say. Whatever they say, you do. And what I've learned from you and from my experience is that the advocate, another way of saying that is being the eyes and the ears for your family or for your parent, so that you can relay things that you know about them. And you assume would be seen or understood by, I think that's what I always kind of felt. And they don't know your parent. You know your parent. And yeah, you can be a bit of a pain, but I think as long as they understand and you can say, this is what happens with him. He tends to have leaks with his ostomy when his stomach gets bloated. I mean, there's things that you can let them know to watch out for. And I more and more I understand that. And then, but more I'm learning from you about actually being able to say things and request for things. And I didn't understand that. So I appreciate this a lot. I hope other people do too.
When we were talking about your dad when he was in the hospital, so your dad's skin is very vulnerable. Okay, he's in bed all the time. He gets yeast infections quite a bit. And you have a very specific routine that you have to do to make sure he doesn't get a yeast infection. So make sure you tell the staff what that is. You may need to bring in special soap or something because they probably don't have the soap that helps with it. Make sure you articulate, like, this is what we do to prevent whatever.
Because for him, he gets them fast.
Yes.
Somebody else might not. But yeah, you're absolutely right. I did tell you about that. We came home and he had a raging yeast infection.
Tell me a little bit about, like, you had a feeling that wasn't getting done and how that.
Yeah, I did have a feeling. And I think this was one of those instances where you are like, well, they know. And they are aware of things. And they're cleaning them, obviously. I don't know if it's due to pandemic and sometimes it's not as well staffed or they got other things on their platter and they just not thinking about it. But no, he was not cleaned. We were getting him ready. I'm like, oh my God. And one nurse was like, oh my God. Like, because he'd been there for 4 days and I don't know what they did when it comes to cleaning.
Well, the people that bathe the patients are not RNs. So some of them are very good. They have a ton of experience. and they know exactly. And then there's just the shift change. So you may have said, hey, this is what my dad needs in a routine. Make sure you do this.
Well, next time I will.
Yeah, next time you will. But then you wondered, like, does that get passed on? And sometimes it doesn't.
Yeah.
Because of, various things. So,
we do usually talk to the nurses, but what's hard is that you're right. The shift change happens and you gave a lot of information to one nurse.
And they're great. They're going to do everything for that.
And they do, but the next one doesn't necessarily know.
It's positive. Like, they aren't doing that on purpose.
No.
Everybody's in this caring industry. They just didn't know.
Yeah, exactly.
So I guess the thing is when they are in the hospital, if you have something like that, you have to get your eyes on it.
Yeah.
And make sure that the skin is good. Like, you have to look at that. And I would always look at, like, if they had an IV, I was like, well, what's that look like? Everything looked good. I mean, I just kind of do like a once over just to make sure everything's...
Don't assume, I think is the key. Yep. Don't assume that it's being done just because you're there. Yeah, I agree.
And I want to talk a little bit about that feeling of something's not right.
Yeah.
And I had this with my dad where the physician came in and said, I'm trying to think of how this, isn't that funny? I know. Forget. Physician came in and said, my dad did not have sepsis. And they were looking at the wrong culture result. So it's a timed result. And the first couple ones he didn't, and then eventually it showed that he was septic. Okay.
Wow.
So I just said, I don't think that's right. And she was like, yes, it is.
That's
and so basically just what, and then I'm like, oh gosh, okay.
We all back
down. And I thought, doggone it, this isn't right. So you have to listen to your conscience, listen to your inner voice. And if you feel like, gosh, something's not right, because people make mistakes. As a nurse, I've made mistakes.
Yep.
And so you have to question that. So every hospital has a complaint line. And not that you're saying, well, this nurse was really mean or whatever. And there's that. But you can also call and say, I have a safety concern. I don't feel like I'm being listened to. I think my dad has sepsis because this doctor said this and this doctor said that. And can someone please look into this? Because I don't think something's right. And so you've got to stop and have that conversation. And the hospitals want you to do that. I mean, they want your parents to be taken care of. They want...
That's a liability for them, too.
Absolutely.
And I got to tell you, I didn't know about that. And what do you call them?
It's just the patient complaint line. And I mean, that sounds like, well, I can't use that because it's not really a complaint. It can also be like a safety concern.
Okay.
So even though you don't really have a complaint, you have a concern.
Okay.
And you have the right to talk about your concerns and just listen to that inner voice.
I didn't
and a
even
lot
know.
of times I'm not good at that.
Yeah, I'm not either, but I didn't even know that was an option, is the thing. I didn't even know that there was a place to call if I had a concern. And I know that typically the manager on the floor or whatever come and say, if you have any questions, if you have any problems. I remember one time we needed more pillows for underneath his legs because he really has to have a lot of support. And I couldn't find anybody. And so I just went to him and I'm like, I actually need some pillows. And he was so nice about it.
Gosh, yeah.
But I guess that may have been who that was.
Right.
And I didn't even realize it. But he was here's my card, call with anything, any concerns. I'm like, wow, that's a nice guy. Lana, I didn't know that until you talked about it. I'm like, oh. So that's actually his job. I just thought he was a super nice guy on the floor.
Right,
I don't know.
Right.
So that's interesting for me to know.
And sometimes it's hard when you think, boy, I'm talking to the physician. But and maybe you're talking to the charge nurse and they blow you off. So this is a way to go above that level and be heard. And at the end of the day, there is a disconnect. Like maybe you don't understand. And so now you have this information. Okay, that makes sense.
Okay, so here's my problem, is I get worried. It's kind of like when you go to the restaurant and then you complain about the food and then you're afraid that somebody's going to now spit on the food because you made a complaint. So my fear in that, I think, is causing a problem that will then be taken out on my dad. Yeah. I mean, is that a real concern or is that just my paranoia? Because I do get that they're not going to want, I mean, if they know you're a complainer, they're like, well, let's not mess with her. So maybe it works better. But I do have that, I think that's just ingrained in me, is don't cause a problem because then people will cause a problem.
I think that is a very real fear, but I think the medical community They are professional, and they really should thank you for asking questions. And you could even say that to the physician and say, after you left, I just didn't feel right about this, and I had to call the safety line because I just didn't get it, and I didn't know how to navigate this. So I appreciate everything you're doing, but I'm just not understanding this. So maybe you just call it out. But I would be very surprised, and I hope no physician or nurse would ever say, well, now we're going to give you bad care because of that.
I don't feel like they would think that, but that does worry me.
I would definitely go there. And you know what? They may be frustrated with the question, but that's part of customer service.
Now that I know what it exists, and then now I realize when that guy kept coming by to make sure everything was okay, that he was seeming to look for real answers. He wasn't seeming to be just full of, full of hot air. So it's actually helpful for me to know that I do have that as an option, because I think there have been times when we felt a little helpless, and to know that there is something that at least we can do, because that's a helpless feeling in those moments.
So the other person that you really want to get to know at the hospital, and every hospital has one, is they are usually called a nurse care manager or a social worker. And what their job is to make sure that your parents have a plan. How I would always say it is a plan for the day, like what's the plan today and what is the plan for the stay. And that means okay, what's going to happen after they leave the hospital? We're going to start to be thinking of that, and they will help you navigate that. So I always ask, who is the nurse care manager? What is their phone number? So usually how I find that out is I call the hospital operator and I say, I need to talk to your nurse care manager department. Okay, bling, there you go through and say, my dad is on 2 West, and who is the nurse care manager? They're never there because they're always on the floor. And I'll say, I need to leave a voicemail.
Okay.
And then I'll say, I'm Lana, and I'm so-and-so's father or daughter, and this is my phone number. I need to talk to you. So get their name and number, tell them what you're concerned about, talk about what it's going to look like when they're home, because this takes time. So you have to start to understand what's happening. Now, the other thing that happens is you do all of that, okay? You're feeling good. Well, then the next day, there's a new nurse care manager.
And you have to say it all over again.
And you have to say it all over again.
My dad had, I want to say deposed. What's the word of discharged?
Discharged.
My dad was discharged on a Friday night, and there was no...
Do you realize the patients that are discharged on Friday, Saturday, I think, and Sunday have an extra % of chance of being readmitted?
Yeah.
Because that's not good.
Oh, yeah, because she was, and not only that, unfortunately, it was her last day. So they didn't even have a social worker taking over yet. So we were completely lost at one point. Well, what are we going to do? Because he was supposed to be discharged, and we didn't even know if he was going to a skilled care facility, if he was coming home. It was utter chaos because, so had I realized that, we would have made more steps earlier. In my mind, you only talk to them at the end.
No, you start on day 1.
See, I really wish I knew that.
I mean, you that is your best
because
friend.
we could have had a plan set before she left, but we were completely screwed on that time because it was now we didn't have anybody. Yeah.
And the physician is really hyper-focused on getting them better in the hospital. Okay,
right.
So that is their focus. They are not thinking about, this is what it's going to look like at home, and we better make sure they have a raised toilet seat and their meals are cooked, and
right.
your parent is really sick and they got to get them better. And that's what their job is.
Yep.
And the nurse care manager or the social worker job, and I would talk to them every day, if and just say,
okay,
are you working tomorrow?
Yeah. I learned that one.
Yeah. And yep, I am. Okay, well, you're going to do this. I'm going to do that. Yep, that sounds like a plan. Let's talk at 3:00 tomorrow and we'll figure it out. And then she'd say, no, I'm not working tomorrow. Well, do you know who is? No, not yet. So then got up, give them a voicemail. And sometimes they did a really good job of sharing that information.
Right.
And it just depends.
Mm-hmm.
And because things happen where it's oh my gosh, they wanted to do all this and then their day was awful with something else and they didn't have time to talk to that person about. I mean, those things happen. So get to know your nurse care manager.
You said something also about getting the reports from the doctor when we were talking.
Yeah. So usually
And is that
physicians,
during or at the end? When you say that?
well, a lot of times your parents will see a physician every day when they're in the hospital.
Exactly.
Usually it's 6 in the morning, okay? And then they see their patients and then they go to their office. Now, sometimes there are doctors that their job, it depends on how the hospital is set up, but they're at the hospital all the time. But if you're seeing a surgeon, they're not there all the time.
No.
So a lot of times you miss them.
I swear, Lana, every single time. And I'm
Yep.
a mile away from the hospital, and I would be like, and I would call ahead and be like, do you know when the doctor's doing his rounds? Because I had highly advised that. And she'd be like, he's going to be starting at 9. I'm like, okay. And I'd get there, and then if I went to get a coffee, I swear he saw my dad in the 2 minutes I was gone. It was like amazing, but I didn't know what to do. Never occurred to me that to ask for a report, or I don't know what I would do. So tell me, please, in that situation, when I've missed him, because I always do, what do I do? What do I ask for?
Well, usually I would talk to the nurse and say, can you please read me the notes that the physician wrote?
Gotcha.
Or, if I wasn't there in person, I would say, can you just tell me what the plan is? And usually the nurse care manager will do that.
Okay.
So there's the nurse on the floor
Okay.
that's doing the meds and super busy running around with their head cut off. And then the nurse care manager can say, like, well, this is the report. So either one, but you can talk to the nurse.
So I have one other problem with this. I'm like, I'm interrogating you. I'm really sorry. I'm like, okay, I have another question for you. But sometimes I want to be there for because my dad doesn't necessarily answer correctly, or he doesn't remember what happened, and I want to be there for the doctor visit so that I can go, no, that's not how it went down, or give more details that my dad doesn't even know or remember or want to share. Then I miss it, and now they come up with some solution, and I'm like, but that's not what happened. He's not remembering what happened. I just felt like I was always out of the loop of how and I tried so hard, but I don't, what do I do in that situation? And I'm meaning this very sincerely. Forget you listeners. I need an answer here.
Yes, exactly. Well, I think realistically you try to be there when they're there. And what I would do, because I was working full time, is I would say, Mom, when the doctor comes in, call me and put me on the phone. If your parents have the capacity to do that, I would recommend that. A lot of them don't. They can't find the phone and they're fumbling. The doctor's like, I don't have time for this,
Right.
Anyway, so let's say that didn't happen and you totally missed, and then you hear the plan of care and it's like, this is not the plan of care that's going to work. So again, talk to that nurse care manager or the social worker or the nurse on the floor and say, I'm hearing that this is the plan and these are the concerns I have.
Are they aware of this and this and this? Because that's usually what it is I needed them to know some things that my dad wasn't going to be able to say. And you said something about how the doctor talked to your mom at one point. Remember you told me that, and then your mom seems...
Oh, she seems
totally with it.
Yeah.
And answering and nodding and saying all the things it's supposed to say, but she doesn't have any memory of anything. And then you told the doctor to go back in and ask her to repeat what you just said, and she didn't remember any of it.
Really good at faking it.
Yeah, so was my dad.
And really good at faking
exactly.
it.
And that's the kind of thing that I think when we say be the advocate is because they don't know your parent like you know your parent. And they can be bamboozled by, my dad is very articulate.
Very.
And he can, even when he's not understanding what's going on, he will make it sound like he does.
Well, a lot of times they'll laugh. So it's like, oh, they're tracking with me, or they're nodding their head.
Yep.
And it's like, they are not tracking.
No. Wow. Okay. So we're going to next talk about when you actually discharge them. Or when the hospital discharges them. Sometimes they can go home with PTOT. Sometimes they can go to a skilled care or rehabilitation or a facility. You know what? That is a whole different episode. We will go into the whole big details of those various facilities in a future episode, right?
Yep.
So let's just right now talk about, in general, the discharge process, knowing that there's going to be more details in the future.
So I'll tell you as a nurse, when someone's discharged from the hospital, it takes a lot of time. You're sitting at the edge of the bed. The discharge instructions, no joke, are probably 12 pages long. And it's just a very chaotic time. And really no nurse has time to sit there for 30 minutes and go through these like you should, right?
Mm-hmm.
So let's just be real about that. I call it a swirl time. So when patients are admitted to the hospital, there's a swirl. And then when they're discharged, there's a swirl of activity. The doctors have to write the order. The nurse has the time to print it off and sit with you. And then there's a transportation person that has to come up and bring them to the car. So it's not just one.
No.
Yeah.
With your parents, if they are impatient people, my dad expects if they say they're going to be there at 11 o'clock and it's 11:01, he's furious.
Yes.
Manage expectations.
Yes.
Prior to it happening, I would like to say things to my dad like, well, they said they're going to be here about 11, but we know how hospitals are. If somebody is, my dad will literally say things like, I'll be like, well, it sounds like they've had an emergency. Why are they more important than me? Type of, and it's like,
well, because you're breathing.
Exactly. I'm like, hello. So the best way you can say it is, nurse says they're going to be here at 11. I'm going to tell my dad it'll probably be closer to 12, but let's get ready at 11 just in case they're early.
I would say if they're going to be there at 11, I would say tell your dad 1 o'clock. It's a 2-hour thing.
I'm going to do a 2-hour lie.
So when you think about the discharge process, okay, so number one, you get these discharge medication list. And I don't know why, but a lot of time the medications aren't right. Something's not right. The last time my mom was discharged from the hospital, there was 3 errors. Wow. So there was a medication error. They said that she had to have a test done. They wrote the wrong test. And they said that she had to see this doctor in a week, and it was actually a month.
Good Lord.
So, I mean, it was disappointing, but it happens. So again, you have to understand.
How did you know?
Because I was told the correct thing, but what was written down was not correct. So I had to navigate that and speak up and say, I was told this and this says this, because everybody goes what's on the paper.
Wow, that's good to know.
Yep. The other thing is think about what time are you leaving the hospital? So if they're calling in medications, or if you're leaving the emergency room, they're calling in medication. So this is an error that we did. Well, what pharmacy do you use? We use the Walgreens on Riley Street. Okay, we're calling it in there. All right, well, we're going to leave the hospital at 7 o'clock at night. We're going to zoom over to the pharmacy. We're going to get the meds, and then we're going to go home. Okay, great. Well, it is not a 24-hour pharmacy.
Oh, God.
So we could not get the meds.
We had that with my mom with her painkillers when she had her knee surgery. All of a sudden it was like, we don't have, what am I going to do? My mom's just coming home from a knee replacement and we don't have the pain meds. That was a very scary moment. So
there's a couple things you can do to navigate that. Some of the larger hospitals actually have a pharmacy in the hospital. So I would say, hey, can you just call it in here? You know, and then you zoom down there, pick it up while you're waiting for the transportation person to come, and then you've got them.
Can you get a painkiller, like at least one before they go? Or, does that, I don't know how that works.
Yeah,
Who do I ask? What do I do?
So that, highly recommend that, especially if you're managing pain. So get that pain pill before you leave the hospital. If you think about the process, okay, so 2 hours to get in the car, 2-hour ride home, then you got to go to the pharmacy. So now you're at 6, they're in a ton of pain, the pharmacy's closed. There's just all these scenarios. So I recommend that you try to get a pain pill right before you leave the hospital, or even if there's an antibiotic, it's like, okay, we're going to take that. Okay. And then we've got it on board, we're ready to go in case something happens. And even if you go to a nursing home, just make sure that they're medicated, because it's going to take them a while to get those meds.
Yeah.
So you really have to kind of think that through. And then the medication names can be very confusing because the hospital will have what's called a formulary list of meds that they use. Okay. All right. A lot of times on the discharge instructions, it will say that name of class of medicines. Okay. Well, your parents are in a different class of medicine at home, and those don't match up. So you have the name brand, you have the class, you have the generic. It can be really, really confusing. And that's confusing for me as a nurse.
Okay, so how do you know what's right?
So you've got to call the doctor's office and just say, I need to figure out these pills.
Is that your primary care physician?
Your family doctor.
Okay.
Yeah. Or the surgeon, but usually I will say, call the family doctor. Now, if you have home care, sometimes that's really helpful if you have a nurse that comes into the home and then they can help you manage that because it's just extremely confusing. You've got to get it right. It's a big deal.
Absolutely. And hopefully you've done so much pre-planning.
Yeah.
A lot of times people feel like when their parents come home that they're like, oh, well, they're at the hospital and now they're all better so they can come home. But actually, they are no longer in an acute situation and they want them to go home to recover.
Right.
And I think that expectation can be startling for the people bringing them home because they are not in their right mind. I got to tell you, when my mom had her knee operation, thank God I listened to the doctor because even for weeks after, my mom would be saying, I don't think this is right. I'm like, remember, she told you. And I would repeat what the doctor had said. She said, this was going to happen in the first week. This is going to happen. She's like, are you sure that's what she said? I'm like, yes. My mom didn't remember. She's a very smart woman, but she's in fear mode. She's in pain. So she's thinking, and, everything's going to be a catastrophe at this point because it's scary.
Right.
And so she's not remembering what was said. So I would say take copious notes also if you can, because they will not remember some of that really important information. I think that's true for anyone. I'm not just saying older generation. I think our brains sort of shut down when we get a lot of that information. So it's really important to not have an expectation that they're going to be feeling good when they get home. Usually they're going to be not feeling well at all, stressed, and they're not going to know what's going on.
And there's a different level of care there. So they're getting 24/7 care in the hospital. And that is not a magic car ride on the way home.
No.
Okay. They are still very sick when they get home and still need a lot of help. So if you're there 1 hour a day, and they just went from 24/7, that might not, they could say, oh, I'm fine. I did great. Well, yeah, because you had someone there for 24/7, and now this is not looking so good. And they don't realize the
and once
there.
the painkillers start to come off, they're actually more aware of the pain that they're feeling when they might not have felt that for a while.
Well, and there's always something about surgeries. A lot of times they'll use blocks and things like that.
Oh, yeah.
And so there's a honeymoon period, and that wears off after 3 days. And usually they're home. And now they're really hurting.
They kick you out of the hospital before that wears off.
Exactly. So third day is no fun. And so if you're home on the third day, that is a tough day.
Okay. Good to know.
Yeah. And a lot of times you don't have the support. It really is a tough day if you've had any type of orthopedic surgery.
The other thing you were talking about was, and this I didn't know either. I feel like I'm learning so much from this. I wish I would have known stuff before. But you talked about what to expect when you're home. Because I know a lot of times they're like, well, we haven't heard from anybody yet. But I'm sure they'll get to us.
So you talked about the discharge planner at the hospital, or so I said the nurse care manager.
Yeah.
Another name is discharge planner,
Okay.
or a social worker. Their job is to set things up and make referrals. So if there's equipment or something, they will make a referral for that equipment. Or if they need home care, they will make a referral for home care.
Right.
So you're like, okay, they're coming, or the equipment's coming. It's like, well, when? No, it's been 4 days, and no, that's too long.
Yeah.
So usually with home care, you should hear from them the next day. And if you don't, you need to call the home care and say, did you get this referral? And sometimes they don't.
Wow.
There was an error.
Yeah.
Or sometimes,
it got missed.
Yeah, it's like, oh, did this fax go through for this piece of equipment?
Again, especially over the weekend.
Yeah, no, we never got that. So if you're not seeing what was on the plan coming through that next day, you have to call.
Who do you call at that point?
So you call the home care agency
that you have been assigned, and you knew who you were assigned to when you left the hospital.
Yep,
Okay.
Yep. And just say, hey, just curious, like, when is this happening? Oh, we didn't have the referral. Or, yeah, we're coming in tomorrow. Okay.
Okay.
So the other thing I want to talk about is just home care expectations. So I used to do home care.
Okay.
And a lot of times families, I was a nurse. Usually the nurse will stay for, I don't know, an hour. Okay. So you do an assessment, you take their vitals, maybe a dressing change or something like that, and then you're gone. And the families would look at me and say, wait, I thought you were going to be here for like 8 hours. It's like, nope, that is not how this works. So for home care, if you have a nurse, depending on what's needed, but they usually are there about one time a week and they're there for an hour. Okay. PT or physical therapy will help them get stronger. They're working on, mobility, walking, sitting, those types of things. So they're there, I don't know, twice a
Dad's
week
was usually twice a week
for an
tops,
hour.
and then after a few weeks, it went down to once a week.
And then in between, guess what? You have homework. You have
You
to
have a
do
lot
the
of homework.
exercise plan.
Yep, that they
So
don't want
who's
to do.
doing that? Because your parents aren't going to do it. I'll tell you that right now. So then there's occupational therapy or OT, and their specialty is like, how are your parents with this new deficit going to go to the bathroom, showering, eating meals, those types of things, like your activities of getting in and out of the car. Are they doing those things safely? And then there's speech therapy or ST.
For like somebody who's maybe had a stroke or something like that. Okay.
So talking, swallowing, communicating, they have to have new strategies on how to communicate because they've lost something.
And again, it's usually like
once a week.
Once, maybe twice a week. Yeah. Absolutely.
And there's homework with that.
And one of the most of the PT people will tell my dad is that they consider for every day that you're in the hospital, it's 3 days of intense PT work to get back. So if you've been in the hospital for 5 days, it's 15 days until you're back to
your baseline.
I mean, the more time you're not getting back to your base, the longer it is. So, and that's brutal because, the exercises, we couldn't get them to stand up at that point. Just Mom or I, we needed the PT person and they weren't even very comfortable with his situation. So it's tricky with that because you need more consistent. You need much more consistent to get them back to where they are. So they're going to have to work super duper hard.
Yep. And then sometimes they'll have benefit to have a home health aide come and help them with bathing and things like that. Again, they're there for maybe a half hour, twice a week, and that is short term.
Yep.
So as long as the nurse or physical therapist or occupational therapist are in, they can have the aide in. But as soon as that's done, they're out.
They're out.
So if they continue to need those services, you're going to have to pay privately for that.
Pay privately, yep.
So it can get really tricky. And so just realize some families have said, oh, well, they have home care. Good, I can go back to work full time. This is awesome. No, you can't.
That's not what that is.
So they are very intermittent and for a very limited amount of time. I do want to talk about making sure you were told when you leave the hospital, these are the signs and symptoms to watch out for. And I can't tell you how many times I would go into a home and people don't have a thermometer. Make sure if they've had surgery that you have a thermometer.
Because they might have an infection.
Take their temperature. And a lot of times my parents would be like, well, it's fine. I'm worried about this. It's fine. I'm not worried about that. And it's like, well, that's not really your decision to make. It's the surgeon's. Well, it's Saturday at 8 o'clock at night. I hate to bother them. They want to be bothered. If you're concerned and they have a fever, they want their surgeries to be successful. And something with like infection or, all the things, you have to report that. Do not wait because then you can really be in trouble. Okay. So something, if you could get in and get an antibiotic, versus, well, now you waited too long and it's in the bone and now they have to do a whole new replacement because you did not listen to your body. I remember one of the patients I worked with, they said, you're going to have knee surgery. You need to do this. Well, they decided that, well, I'm laying down. What's the difference between being in a car and laying down? And so they drove to Texas because they didn't want to miss their snowbirding opportunity or whatever. Well, there was a whole infection in the bone, all that stuff. They should have said to the surgeon, okay, does that mean, can I be in the car for 2 days straight?
Oh
no,
my
you
God.
cannot. So you have to communicate with your surgeon and make sure that those decisions you're making, don't assume that you're not a physician.
And a lot of times I think people think the less they say, because they know the surgeon's going to say, no, don't go. And they're just being overly cautious. I think that's how people feel. Oh, you're just being overly cautious. But if I tell him that, then he's going to be like, no, don't do it. So I'm not going to tell him.
Yeah, that doesn't apply to me.
A weird thing.
Yeah. So there's just a lot of safety concerns as well. So now you've got this deficit. Everything's different. You have to do everything different. And you're at very high risk for infection and injury. And people just kind of poo-poo that.
I think we will do a future episode about the facilities that happen after a hospital visit and about how we motivate when they get home and what we have to do to try to get them to eat right, to drink liquids, to do their PT and their OT. Those are future episodes that are extremely important in this whole process of the hospital visit. But thank you, Lana, for so much information. I feel like I learned a lot right now that I really wish I would have known over the past years. But I know it now for the future.
More. But these are just some tenets that you can...
I think it's...
So,
don't tell me there's a lot more.
I know. I feel this as a nurse, though. I'm like... I know I'm forgetting something, and I am, but there's just a million scenarios. But, I mean, these are some guiding posts that you can...
I think what I've gotten mostly is ask questions, be proactive, try to handle it before the process.
And be an advocate.
And be
be
prepared.
You can apply those. That's perfect.
That's life.
Yeah. So.
But thank you so much. That was really good information.
Thank you so much for listening and sharing your time with us here at Lisa and Lana Taking Care of Our Parents. Next, we need to pack our bags
because we are going on a guilt trip.
If you enjoyed our podcast, be sure to hit subscribe. Thanks so much for joining us today. Until next time.
Two old friends talking to